Hey friends, welcome back to Notes to My Nervous System. I'm Erin, a mom, a therapist, and creator of the Mind Circuit app. Today we're joined by Madeline Romito? Romito? How do I say this?
Romito.
Romito. Okay. My viewers know that I have a speech impediment, so they're used to me messing up my words, but your name is important, so I want to make sure I got that. So Madeline Romeo, a doctoral candidate and therapist specializing in eating disorders among diverse populations. Her research is exploring how eating disorders function as a nervous system survival strategy. She's here to share her insights on compassionate care for youth, exploring their relationship with food and disordered eatings. Thank you so much for coming. Is there anything from the intro I left out that you want to add in?
No, I think that captured everything. It's a pleasure to be here. Thank you so much.
Thank you for coming and sharing your knowledge. I just like to jump into things and I just like having good conversations with people. Eating disorders is not my expertise. I run into it occasionally as a trauma therapist. Once we get through that trauma piece, then I will generally refer out to someone who has more experience with it. What made you go into that and pick that avenue? And then what is some background around how it impacts the nervous system?
Yeah, so I specialize in eating disorders, disordered eating, and body image because of past research experiences, but most importantly, my own personal story, which is not uncommon in the eating disorders treatment field. It's similar to the substance use field, in that a pretty high percentage of people who treat eating disorders have some personal experience with it.
Feel that helps you as a clinician?
So I do personally, yes. I don't know that's the case for everybody or how every therapist might feel about it. They have their own experience, but I do believe that it does help me in my practice.
I know within the addictions community, therapists who have gone through addictions feel that it definitely helps them to have a better understanding of what it feels like. They don't discount therapists who haven't been there, but it just gives them a level of understanding that only one could get if they went through it.
Correct. Yeah, there are certain things that I might pick up on or be able to speak to that I think people who have been so hidden about their behaviors may appreciate that I'm able to talk with them about or to understand. It can, now, this is not to say that I disclose my lived experience to every client. My personal approach at
whatever's appropriate at the time.
Right. It depends on the client, but when I do share that, a lot of times it goes a long way in terms of establishing a rapport and sense of safety and trust. Now, that, again, why it might be important to be selective about with whom and when to share it is that it can, now I've not had this experience as of yet, but it can also create tension or questions or things that wouldn't be helpful for a client as well.
So you have to be careful about what you disclose as a therapist, because then the attention might come on you and it could be a way for them to deflect from actually working on their own crap.
Yeah, it can. I think on one hand, to me, everything is grist for the mill. Handled, even that could turn into something therapeutic. And I think in most circumstances could be, but it does open the door to some clients wanting to ask a lot of questions that maybe you have to make a lot of decisions on the fly about what to answer or how to answer and how much information to disclose and that kind of thing. But it introduces a certain awareness of the fact that we're two bodies sharing the same space. I think even in virtual therapy, right, there's an element of this, but certainly with in-person that is present in any therapeutic relationship, but especially when there's hyper focus on bodies, And I am essentially coaching someone to perhaps have a very different and less fraught relationship with their body. Inevitably, there will be some attention on mine and how it compares to theirs. And so that brings up a whole kind of topic of broaching body
Now, have you
size.
noticed that increase of the comparison, especially with the increase of social media?
I'll be very honest.
Please.
My professional work didn't start prior to social media. So I don't have anything clinically to compare that to.
I just aged myself.
Yeah, no, no worries. But I do think that social media does open up this constantly available opportunity to compare each other and oneself to images that may or may not be realistic, that can be heavily edited. I don't necessarily take the stance that social media is the evil of all evils. I think there are pros and cons, but there are certainly ways that social media can promote or exacerbate negative body image and disordered eating.
And your research, it focuses on disordered eating, and then what's like within that?
So I have done research on eating disorders and disordered eating in a variety of populations. I've done a study on postpartum women, youth with gender dysphoria or who identify as trans or non-binary. My dissertation is on gender euphoria and eating disorder recovery among trans and non-binary adults. Gender euphoria being different than gender dysphoria, not exact opposites. However, gender euphoria, as the name suggests, does refer to positive feelings or a sense of joy related to one's gender. And then also the intersection of play therapy and developmentally appropriate interventions for kids who experience body image concerns and disordered eating.
So what is your hope with this?
My general outlook on my personal research is that I am not looking to run randomized controls trials or obtain massive federal funding, which is all very valuable. The way I see my role and my skill set and strengths is playing out in research is through giving voice to the, how do I say, maybe more realistic or very naturally occurring diverse experiences of disordered eating and eating disorders, especially where maybe there hasn't been a lot of attention given in the past. Because I think the eating disorder field's at a place right now where it's no longer this field that didn't exist 10 years ago. And
it's only 10 years old.
Oh, no, it's much longer than that. But I guess what I'm saying is that, yes.
Like I know in the realm of things, it is actually somewhat new compared to other disorders, which is very sad.
Yeah. So it just hasn't gotten as much attention. We're at a point now where, okay, we've established that these things definitely exist. We have standard treatment protocols. We have treatment facilities. But in what ways is this not working? And are there people who struggle with these things that we maybe haven't given as much attention to? So diversity and inclusion are big topics in eating disorder and the eating disorder treatment sphere.
No, as soon as you mention eating disorder, my bias thinking just goes to a cheerleader type person in high school. I don't think about the postpartum moms. I don't think about the trans community dealing with that, but I could absolutely, the moment you mentioned it, totally went, oh yeah, of course. But it's not where my thinking goes. So I think this is really important that you're shedding a light on all these other populations and subgroups that are dealing with all of this that I would never have thought of.
Yeah. And another important one that I haven't touched on with my research yet is the population subject to food insecurity and how disordered eating actually occurs at higher rates, which is very much contrary to the stereotype, the swag stereotype, which is small, white, affluent girls. Yeah, just a lot of food for thought.
I could see how the food insecurity, not knowing when you're going to get your next meal, would make you almost obsessive and wanting to have that disordered eating pattern because the fear that comes with you don't know when you're getting your next meal.
Absolutely. Yeah, complicates relationships with food for sure.
And that's another one I had never thought of. Really interesting. What is something that you would like people to be able to take away from this, a better understanding of?
That eating disorders don't discriminate, that struggling with disordered eating versus a clinically significant, meeting all the diagnostic criteria eating disorder is still distressing and worthy of acknowledgement and care, that we have a really long way to go in terms of understanding eating disorders and how to help people experiencing eating disorders.
Do you find that people will lean on the fact that they're not clinically diagnosed with the eating disorders? It's not that bad.
Sure. I think that even for people with clinically significant eating disorders, it's not uncommon to feel like they're not sick enough for help or sick enough to justify change, because there's usually a lot of fear and or shame associated with making this type of change toward oneself and with behavioral change toward food. And therefore, it can sometimes feel easier if there's a level of severity that warrants an emergency. Whereas if someone maybe isn't in an emergency situation with their, say, physical health or mental health, they may not feel deserving or it matters enough to warrant how difficult the change process is.
So they would be giving themselves these like negative thoughts, like pushback that, no, it's not that bad, even though their body and their nervous system would be most likely giving them warning signals, trying to get their attention that they need to do something different.
Correct. Yeah.
Well, what's the impact with that negativity and thought process and denial of the body signaling?
So it's, and before I say anything more, I'll preface this by saying that another issue in the eating disorder treatment field that I think is coming to light more recently is the idea of anorexia focused treatment. So I want to be mindful about the ways in which I'm answering these questions and how they may be more reflective of the experiences of those with anorexia compared to those with binge eating disorder or having some sort of binge behaviors, or who aren't of a significantly low weight, whatever that means. That's a whole other conversation. But yeah, I guess the relationship between maybe not being attuned to one's bodily cues and having an eating disorder, or the emotions that come along with a negative relationship with one's body and with food, I think they really go hand in hand. And it can, depending on the person, be a bit of a chicken or the egg situation. I think for some people, I guess the current understanding of eating disorders is that it's a biopsychosocial condition. And so if we think of some of the bio and psycho elements of, say, someone who has a form of neurodivergence that makes interoception, so the internal sense of one's bodily cues, more challenging than, say, someone who isn't neurodivergent, certainly can predispose someone to developing an eating disorder. There are also sensory issues that then can show up with food or in textures or temperatures or what have you. So there's that element where someone's nervous system might be hypo or hypersensitive in certain ways that can influence someone's relationship with food and or their bodies. And then there are also external factors, referring to that social piece, that can then influence the bio and psycho part in terms of various forms of trauma that can lead to someone dissociating from their bodies or finding their bodies an unsafe place, and or like overemphasizing external perspectives on one's body such that an internal sense of one's body is dismissed as unimportant. And then there's the bio part of things where there can be medical conditions that might predispose someone to have a hard time tuning into their body, or may even have a body that's giving cues that are very confusing. So I hope that made sense.
No, it just how complex interacts with all the different body systems. This idea of mental health and within disordered eating, that it's your mind only type thing. It just drives me bonkers, because that's not the way the body works. It's not the way the body heals. And you can't just say that it's mental health and it doesn't impact the rest. That drives me batty. I just don't see how anybody could logically feel that. Everything interacts with each other. Everything has an impact on some aspect of your life.
For sure. Yeah.
You brought up something I want to touch on it quickly. We finish up that whole weight and BMI. The whole BMI thing pisses me off and is such a myth. But how does that come into when you're doing a clinical diagnosis with the DSM? It's not like the DSM says this BMI or this weight, but it does refer back to what the medical community has deemed appropriate weight.
Yes. Anorexia, out of feeding and eating disorders, is anorexia and atypical anorexia are the only ones specifically referring to weight as a diagnostic criterion. And it did used to be the case that there was a BMI cutoff for what counted as significantly low weight. That is not the case anymore. However, weight is still, or weight loss is still a factor in diagnosing anorexia as compared to bulimia, binge eating disorder. ARFID, so avoidant restrictive food intake disorder, can be reflected in someone's weight, although that's not required, right? Basically, someone's inability to consume adequate food can cause what we deem a clinically significant problem if it's affecting their nutritional status, if it's impairing them socially or preventing them from doing things in their lives that they need to do, or if it's affecting their weight or their growth. So yeah, but anorexia is the only one where that's a required part of it. And it's unfortunate, and I hope that in the coming couple decades that does change. There's a lot of talk about how atypical anorexia, which is the presence of the same behaviors and psychological factors as anorexia, and also signs of malnutrition without this clinically significant low weight, that it's actually a lot more typical than what we're apparently calling typical anorexia. So yeah, it's still evolving at that large scale level.
But clinically, you see your group of individuals, clinicians in that field, being more aware of how standard weight or BMI is actually BS and very skewed.
Yes.
Okay. So we just need to keep getting the info out to the public, to the parents, to the individuals.
Yeah.
Cool. That makes me feel a little better.
Yeah, absolutely. And what I would add to that also is that even if someone has been at a very low weight at one point in their lives as a result of disordered eating behaviors, that doesn't mean they're not still struggling if and when their body changes and or if they're weight restored. I think it's important to recognize that an eating disorder and the struggle can persist even past restoration of one's physical health, if you will, or weight restoration.
So just because visually the person looks like they gained some weight, does it mean that everything's fine and we should just brush it away and move forward?
No.
Yeah. No, I get that, but I could see how my generation and the generation before me, baby boomers and whatnot, how we very much have been trained to look at a person. And that's what we would judge anorexia from. And binge, not so much visually, but anorexia, absolutely. And I could see how it could make the family and the support system not take it as serious if the person does gain the weight back. It sounds like that's the wrong way to approach this because they're still having that disordered thinking around eating.
Yeah. And there can still be disordered behaviors as well in terms of rituals that someone is performing with food or rigidity around the times that they're eating or what they're eating, or they maybe having to have a lot of control over the amounts, refusing to eat with other people or refusing to eat out. So there's a lot that can be happening in one's relationship with food and their body, right? Things like body checking or wearing only certain types of clothing, whether that's to hide or to accentuate certain things. Yeah, there's still a lot that can go on, even if someone is visibly not the picture of what we imagine the eating disorder looks like.
Thank you so much for that. It was very enlightening and definitely gave me a lot of questions to be asking myself, not only as a mom, but as a clinician as well, how just skewed my thinking process was around that. And I'm in the field, so I can't even imagine individuals just out and about how skewed their view is of it and how many people are probably going under the radar because of the skewed beliefs and biases that just aren't true.
Yeah, absolutely. I always like to say when someone says, "Oh, I don't really encounter that," whether it's a medical doctor or a therapist, I'm like, maybe you do. And you just don't know. The same way that I might not have the same level of awareness around other things, but it is, to me, from my perspective, a pressing issue because even for the people who are getting treatment and for whom an eating disorder is recognized, it's very hard to recover into a world that supports disorder.
That's very valid. You work on feeling better and then you go back into the same environment. And it's such a confusing message around food and calories. And
yes.
Ooh, yeah. Thank you so much. I really appreciate your time.
Absolutely.
And thank you to our listeners and viewers. This has been Notes to My Nervous System, and hopefully you took something away from this that will help you better understand your body and how complex it can be. Thank you for listening to this episode of Notes to My Nervous System, where we explored disordered eating, eating disordered recovery, and how these conditions can impact the nervous system. Something I haven't even thought of, but so important to put a spotlight on and talk about. Remember, understanding the connection between mental health, body image, and the nervous system wellness is essential, and they all go together. For more expert insights and tips on supporting yourself or loved ones with disordered eating, subscribe, visit our website for resources, show notes, and upcoming episodes on disordered eating, recovery, and holistic health. There's also websites out there. You can always go to 988, contact them. That is the mental health crisis, and they can connect you to free resources for disordered eating. Please talk to your pediatrician. Then let's just make this a common question that we check in with our kiddos. Thank you for turning into Notes to My Nervous System. Today's episode resonated with you. It'd mean a lot to me if you could leave a review and hit subscribe. But before you head out, let's take a moment to notice your body. Your feet on the floor, your breath, the chair supporting you. No need to change or fix anything. Just let your nervous system know it made it through another moment and that it's safe here. If this episode brought you even a small sense of steadiness that truly matters, that's exactly why this show exists. And if you'd like more gentle, science-backed resets, check out my app, Mind Circuit. It's on the Apple Store or Google Play. It's a calm moment, a calm spot just to help your brain settle when life feels a little too overwhelming. As always, thank you for being here. Remember, your nervous system deserves care, not more pressure. And please be gentle with your own life.